coming up, we'll be on location at Springs Health LLC in Columbia, Maryland, discussing advances in mental health and wellness treatments and how they can effectively treat mental health issues such as stress, anxiety, depression, addictions, and more, as well as helping you improve your overall mental health and wellness with one of this region's top psychiatrists, Dr. Chiedozie Ojimba. Welcome, Dr. Ojimba. It's a pleasure having you on our program today.
Thank you, Mr. Walker.
We have a lot to talk about, but I wanted to begin by letting all of you out there know that Dr. Ojimba is certainly widely recognized, not only as a top psychiatrist and mental health expert throughout the Maryland region that helps folks dealing with a number of mental health issues, from reducing stress, anxiety, better coping with depression and other mental health issues, but you also focus on and specialize in as well in addictions and substance abuse issues, which is a huge problem everywhere for that matter. So we are certainly very proud to have you on with us today. And I wanted to ask you if you can please start off by sharing and telling us about the vision for your practice and your approach to mental health treatments and helping your patients.
Springs Health LLC is a practice that has quite talented professionals, mental health professionals who are here working as a team to be able to help our patient population, which are vulnerable population, patients suffering with mental illnesses as well as addiction, what we usually call now substance use disorders. So our goal is to help patients to study what we call the revolving door phenomenon. That is whereby patients kind of keep going in and out of hospitals just because they are very unstable. So our intention and hope as a practice and as a team is to be able to help our patient population in the DMV area to remain stable within the community, to be able to live a healthy, productive life in the community, to be able to help the community where they live, and to be able to stabilize and be comfortable without going in and out of hospital. And again, one of our aim is to be able to help as many patients as possible to be well-informed, knowledgeable about mental illnesses as well as addiction, to be well-equipped with knowledge to be able to help for them to be able to care for themselves as well as to care for their loved ones. So all in all, we're here in Columbia. Our aim is to be able to be at multiple locations in no time, to be able to help as many Marylanders as possible. And that is why for the meantime, for those patients who may not be able to physically come into our location here in Columbia, we are able to see them virtually. Thankfully, it's still allowed for providers to be able to see their patients anywhere they are virtually at this point in time. So in terms of our approach to treatment, at Springs Health, we pride ourselves in a holistic intervention whereby the treatment goals for each patient is individualized, recognizing the fact that not every patient has the same issues or might have different things affecting them in terms of psychosocial or other social issues, or biologically other things that might be contributing to their mental illness or as well as addiction issues. So we kind of individualize our treatments by being able to understand our patients, being able to understand other social stressors that might be impacting their mental health as well as their addiction issues, and use that to develop a unique, tailored treatment goals and plans that will suit each patient for their quick recovery, as well as to be able to lead a productive life in the community.
Yes, indeed. I love the integrative, holistic approach, as you just touched on, individualized approach that you utilize here, because, you know, we may even have some of the same issues in society when it comes to mental health issues and related issues within mental health, but we're all different individuals. So what may work, you know, for one person may not necessarily be effective or help another person. So therefore, that customized approach through the different treatment plans and the individualized approach, as you again just mentioned a moment ago, I love that you offer that and utilize that. I also love the telehealth component, right? That makes it convenient, as you mentioned a few moments ago as well, where your patients can see you both either in person, if that is more convenient for them, or you can help them in the comfort of their home or wherever they are, based through the telehealth option.
Yeah, absolutely.
Now, I also wanted to ask you, Dr. Ojimba, what are some of the more common issues that you address and treat at your practice?
When you say common, I would say with three diverse psychopathological cases, both are from mental health aspects as well as addiction, and that is why we are a dual diagnosis facility. When I say we are dual diagnosis, it means dual means two, that we are treating a combination of patients who have either mental illnesses or substance abuse. I'm using that word for people to be able to understand, but we don't no longer use the substance abuse because it's kind of seen as something that is a little bit stigmatizing. So we use substance use disorders, and then or patients who have a combination of both. Right. So all over the world, the most prevalent number one mental illness in the world is anxiety. So it is here in the United States. And I can tell you, 95% of our patients do have one form of anxiety issues or the other. And the number two most prevalent mental illness in the world is depression. So it is here in the United States. And most of our patients will have one form of depressive disorder. Right. So these are the most two common mental illnesses that we tend to encounter. Not just only here, but I believe my colleagues in other places will attest to that this is actually, and that is why they are the number one and number two most prevalent mental illnesses in the world. When it comes to substance use disorders, the number one, right now is cannabis, but again, things like alcohol use disorder. But in my practice, I have a quite greater number of patients with opioid use disorders. So patients who are on treatment like things like Suboxone, and then of course I have also a prevalent number of patients who come in for alcohol use disorder. And then among the adolescents and teenagers and young people, we have seen an uptake and increase of cannabis use disorders. Patients who have encountered a lot of bad outcomes due to either by way of trials or unknowingly, use cannabis in a way that it has affected them adversely. And so we tend to see quite a number of patients, young people, adolescents and teenagers from high schoolers actually, or sometimes even middle schools who are experiencing adverse effect of cannabis use disorders.
Yes. And of course, the opioid epidemic continues to unfortunately and sadly persist. And you have, as you touched on just a moment ago as well, you have options at your disposal here and your expertise in helping those folks.
Absolutely, yeah.
I also wanted to ask you, Dr. Ojimba, what can cause these conditions to occur? And again, I understand everyone's different, right?
Yeah.
And there are different things or triggers that affect folks in different ways.
Yes.
But generally speaking, what are some of the more common causes for these issues?
It's actually the pathogenesis or the cause of mental illness as well as addiction is multifactorial. There's quite a lot of factors, a lot of causalities involved. Number one being genetics or hereditary. So there are some certain genes that have been implicated um, in some certain illnesses, things like schizophrenia, bipolar, even some mood disorders, things like depression or um, like a twin study or adoption study has actually shown that that is actually one of the ways that shows that genetics has a big role to play in some of the pathogenesis of these illnesses. Another factor is biological factors. When I say biological, um, the way our body functions, there are a lot of what we call a layperson will say you use the word chemical imbalances.
Yeah.
We call it and neurotransmitters. These are kind of what patients might call chemical. And when you have either an excess or decrease of any of these neurotransmitters, they can actually be implicated in mental illnesses. The most common neurotransmitters that have been implicated are things like serotonin, so norepinephrine and dopamine. These have been implicated in the pathogenesis or the causes of depression and anxiety. Again, if there is anything like a trauma to the brain, that can actually also biologically kind of cause some of these mental illnesses. And we look at things like a psychologically, there are some personality traits, some things like a neuroticism, or maybe some patients who have a poor coping skills. All these things are kind of personality traits that can lead to causes of some of these mental illnesses as well as substance use disorder. On some of the social factors which actually play a significant role or kind of perpetuate or predispose some of these mental illnesses, things like the social determinants of health or mental health, things like unemployment, socio-economic status, things like homelessness, all these things can actually lead. And some other medical conditions too, things like thyroid disorders or traumatic brain injuries can actually cause some mental illnesses. So as you can see, that's quite host number of factors, and sometimes all these factors kind of interplay. That's not just one factor causing it at a particular point in time. So you might just have multiple factors, working at the same time and causing either any of these illnesses.
As you just said, it could be one, it could be a couple of them, or it could be a combination of several of these factors that causes that particular condition with each individual.
Yes.
And what is the evaluation process, Dr. Ojimba, for diagnosing a patient's specific issues from when they initially contact you and come to meet with you for the consult, or you do the consult through telehealth?
Yeah, so thank you for asking that question. Our typical evaluation process will entail first, a patient who calls the office. Sometimes we have patients that call in the office and the appointment the appointment is made, or patients can book through our website or other sources. They will submit their biodemographic information, things like insurance and all those things. And once everything is kind of checked out and the patient meets all the criteria that we need. We do not discriminate in terms of like the kind of patient population. So we see all patients, from psychotic patients who have mood, anxiety, or addiction. So we see all kind of patients. But the most important thing also, we do accept insurance. So we just make sure that patients' benefit covers, and we're able to tell patients if they have deductibles, if they have co-pays, whatever it is, we kind of let the patient know. And on the day of the evaluation, patient comes in or virtually, is being welcomed by the team, and we talk to the patient to be able to first start with being able to listen to the patient. Just tell me what brought you to us, and patient is able to have a whole time to be able to express their concerns, what brought them, what help they are looking for, and listen to them we can be able to work together,
Yes.
and together we're able to also formulate a diagnosis and say, okay, this is what I think might be going on, and we together also we formulate the treatment goals.
Yeah.
So it is a situation whereby not just the provider telling the patient what to do, but the provider and the patient working together to come up with the best suitable treatment goals and plans for our patients.
Yes, indeed. I love the comprehensive approach, the thoroughness to really help each individual best achieve the outcomes and goals they're looking for.
Yeah.
Is there a typical candidate, Dr. Ojimba, that can develop some of these mental health issues that you touched on today based on, say, age or gender, for example?
Unfortunately, mental illness or addiction is no respecter of anybody. So any individual can develop mental illness or substance use disorders. And regardless of the age, or gender, or socioeconomic status, or cultural background. So again, there that notwithstanding, some other factors can uh, make some of these mental illness to manifest, just like some other factors I've mentioned in when we talked about the causes.
Yeah.
You know, things like genetics, things like biologicals, and all those things, psychological as well as social. So these can actually trigger or predispose or perpetuate mental illness, and so even most of the mental illnesses do tend to happen more in adolescents and young adults, but we tend to see quite a lot in kids. You know, kids as young as 3 years old, 4 years old, and 5 years old, and some mental illnesses are more prevalent in men compared to female, and vice versa. For example, substance use disorders commoner in men compared to women. As why things like depression, anxiety, you see it more in women compared to men. So these are some of the little variations in terms of gender, where you can see some of these. But other than that, you know, anybody can actually be affected by mental illness and as well as addiction.
And what would you say are some of the most effective strategies or therapies that are available to help folks address these issues?
In terms of the most effective, again, it all depends. Sometimes what works for one as the most effective may not actually be what works for the other individual, and that is why treatment goals are still being tailored, well individualized.
Yeah.
But in general, the best outcome is always achieved with a combination of medication as well as psychotherapy. A combination of these two always give a much better outcome in terms of recovery for patients. So here, what we always advocate and tell patients is it's always good. Most times we have patients who come to us, they already started with therapy, and most times it will be their therapy that will refer them and say, oh, I think you need to see a psychiatrist, and they come. And most times they come, they don't have therapies, and we will encourage them that, educate them that this alone, medication alone cannot do the work. Again, while we do offer them individual supportive therapy, they also need to be able to work with psychologists or therapists who can see them on a more weekly, or even sometimes, depending on the severity, sometimes twice a week. Again, there are much newer modalities, or what we call interventional psychiatry, whereby sometimes as an adjunctive, things like transcranial magnetic stimulation, in short form TMS, that can be used to treat patients who have what we call treatment-resistant depression, whereby once one or two medications or more than two medications have failed to be able to control patients' depressive symptoms, that means that is considered as a treatment-resistant depression. So at that moment, patients can benefit with what we call adjunctive treatment. Before, there used to be things like a ECT, a kind of a shock wave to their brain. But these days, we don't, not too many patients, because of the adverse side effects that's associated with ECT, we tend to use a much newer, less adverse effect related intervention TMS, which is more like a stimulating the part of the brain that is responsible for happiness, for mood, to be able to stimulate some of these neurotransmitters that we talked about before, things like dopamine, serotonin, and then norepinephrine, to be able to keep patient in a much happy mood. And there are also other interventions, things like esketamine or ketamine intervention. These are much newer modalities of treatment for depression. So, like in science, much newer options are coming up. Even these days, there's things like ketamine-assisted psychotherapy, whereby patients do psychotherapy under the influence of ketamine. And of course, psychedelics and other things are still in the work right now, being explored to see how that can help patients. So that's quite diverse arrays of treatment modalities available for patients. But again, we just have to start with the most common ones, medications, and see how that helps the patient. A combination of medications and psychotherapy, and that helps.
Yes, indeed. You have a number of therapies and tools, if I may use that term, in your toolbox here at your practice and with your experience to really utilize and customize the appropriate treatment plan to help each and every one of your patients as you do. And I love the fact that you offer both also the TMS therapy and the ketamine infusion therapies, because as you said just a few moments ago, Dr. Ojimba, highly effective those therapies have been proven to be when it comes to helping folks specifically with depression, among other issues.
Absolutely, you're right.
Now, I am sure the answer to my next question, Dr. Ojimba, certainly depends on each individual. Everyone's different, as we've already discussed earlier in this interview. But generally speaking, what type of results do your patients typically see?
Most patients always expect to be treated and to be symptom free. So basically, most patients, again, uh, it's not the same outcome. It varies. Some patients, depending on the severity, depending on the acuity of their symptoms, some patients might just have a one single episode of mental illness, and they will recover completely and never have a subsequent episodes. Others might just have a recurring episodes, or even an ongoing treatment. So the end game, or the expected outcome of most of our patients is, first, to have a symptom reductions, to be able to be relieved from the symptoms that is actually affecting their life, to be productive in the community, and then to prevent relapse or the compensation from subsequent symptoms. So this is always the expected outcome whenever we start a treatment. And most patients, and we will always tell them, depending on how, again, depending on the pathology, like some addiction and mental illness is a chronic disease. Sometimes it could be a remitting and relapsing cause, whereby patients might get better and, and subsequently they relapse. And sometimes when patients relapse, it's not due to fault of their own, not because they are not complying with the treatment. Sometimes it could just be that the medication is no longer effective, and there might just be a need for adjustment. So, and that is where non-judgmental approach comes in, just being able to work with the patients in a kind of always applaud patients when they do something good, especially when it comes to compliance and adherence. But I can tell you, no doctor can say that they are good without a whole compliance of that patient, because it's only when the patient complies and keep to their own part of the bargain, take their medications, come for follow-up and come for treatment, that the effect of the medication will be seen, and doctor will be happy. But if you don't work with your patients so that they can remain compliant, it seems like the doctor, whatever effort you're putting in, is not going to be seen. So that is why I always applaud my patients whenever they are very compliant with their treatment plans, because What that means, at least when the medication is working, we know whether it is working. When it's not working, we know, okay, I think it's not working, and we can always change course.
Yes, indeed, and it's really a partnership, right?
Yes, it
Between
is.
you, the doctor,
Yes.
and the patient.
Yes.
And you can only, like, for example, you can show them where the water fountain is. You can help them get to it, but they still have to lean over to drink the water, right?
Yes.
If I may use that simplistic example.
Yes.
And that's where the two of you working together to really help each of your patients achieve the optimum outcome,
Yes.
to
You're right.
improve their overall mental health and wellness at the same time.
Yes, you're right.
Now, you briefly touched on the number of sessions per week, or as far as the frequency goes, in helping your patients. And I'm sure that also depends on each particular individual, what that particular he or she is unfortunately dealing with, and the appropriate treatment plan that you customize to help that person. But generally speaking, how many sessions do you recommend, whether it's initially, over time, and any tune-ups, if I may use that phrase, after you've helped them?
Yeah. Mental illness and addiction is different in terms of how patients can follow up. So a typical follow-up sections depends again on patients' symptoms, reduction, and their recovery outcome. So if a patient is actually doing well and being stable on the of their symptoms and complying with their treatment goals, of course, that patient can be seen less frequently, but that doesn't mean you can see them. You're still gonna be seeing them. But if patient is having a more severe, because especially in mental illness, our number one priority is always safety. Safety of the patient and safety of others in the community. So we want to be sure that patient is safe. So if we have situation where patients are feeling unsafe, we feel like patients, that's a safety issue for patients and others in the community. The patient needs to be seen more often. Of course, it might get to the point that if it is unsafe to see patients in an outpatient setting, the patient will be advised to go for an inpatient hospitalization. So it varies how often. Some patients can be seen on a weekly basis. Some patients can be seen like what we call intensive outpatient treatment on a daily basis for like a number for like 2 weeks, 3 weeks. And then when they are more stable, they can be stepped down to like a weekly to weekly. So it varies on how patients can be seen again. It's individualized.
Yes, indeed. I love that customized, individualized, practice mantra that you utilize and help your patients with. I also love the integrative holistic approach. You look at your patients from a holistic, a whole mind, body, spirit perspective. You look to help find the root cause of the issue or issues that your patients are experiencing, to really help them achieve, ideally, not only relief from the mental health issues they're dealing with, but also ideally permanent relief if and when possible, right?
Yeah, if and when possible, just like we
Yes.
talked about before.
Yes, indeed. And on that note, we'd like to thank you, Dr. Ojimba, for joining us, educating us, and being a guest on our program. It was certainly a pleasure having you on with us.
My pleasure too.